Hi, I'm Dr. Han Vong, and in this video we'll be talking about some of the things that we do for a patient who presents with meniscal injury or tear. A meniscus is basically a cushion, a soft tissue that's located in between the two joints within the knee, and its job is to absorb shocks and stabilize the knee. Now, sometimes we injure this area, and if we do nothing to address it, what happens is this minor injury can lead to a meniscal tear. As a result, it can lead to a lot of pain when we walk, and in the worst case scenario, it can lead to DJD, which is also known as degenerative joint disease. And ultimately, it gets to a point where basically we don't have any cushion there anymore, so the two bones within the knee are grinding on one another when we walk, and at that point we might need surgery and even a total knee replacement. So the first thing that we do with patient that has meniscal tear is that we check to make sure their knee joint itself is properly aligned. A minor misalignment within the knee can throw off the weight distribution of the body, because when we walk, both our knees are taking a lot of our weight. As a result, we want to make sure those weight are distributed evenly. Now, if there's a misalignment within the knee, some of the areas of the meniscus taking up more of their weights versus the area that's going to take more of the weight over time will be more prone to injuries, and is usually the major cause of meniscal tear. So we have to make sure the knee is properly aligned, and if not, we have to adjust the knee to make sure everything is working right. Now, the next thing that we have patient do is basically rehab exercise that the patient will be responsible for doing while they're at home. So let's jump right into it. Okay, the first exercise that we will be doing is called straight leg raises. We want to make sure that we're not doing this exercise on the bed. Make sure you do it on the floor, the carpet, the mat, somewhere that's a little bit firm. And so we basically bring both legs up and hold it for about 10 seconds. After 10 seconds, we let it down slowly. And then once you let it down, you want to rest for about 3 seconds. And after 3 seconds, you want to go ahead and bring this back up. Again, same thing. Hold it for about 10 seconds. After 10 seconds, we'll let it down slowly. And then rest for 3 seconds. I'm not holding for 10 seconds for the purpose of this video. We're just going to do a few seconds. And make sure you want to do 20 of these every time you do it. So again, bring both legs up, hold it for about 10 seconds, and we're going to let it down slowly. Make sure you let it down slowly. And then rest for about 3 seconds. And then you basically repeat this 20 times. The next exercise that we'll be doing is called bridging or hip raises. So this is the position that we will be in. And we basically just lift up and hold for 3 seconds. After 3 seconds, we can go ahead and relax, lower our body, and slowly. Then we come on back up, hold it for 3 seconds, and lower slowly. We want to do this for 20 times, and we want to hold it for a minimum of 3 seconds to begin with. If 3 seconds is too easy, we can hold for 5 seconds. If 5 seconds is too easy, we can hold for about 10 seconds. We don't need to go any further than 10 seconds at this point. So again, lift up, hold it for about 3 seconds, and relax. And we do this for 20 times again. The next exercise that we'll be doing is called leg curls. So we want to lean up against a wall for support first, and then we'll bring one leg up at a time and then let it back down. We want to do this 20 times per side. After do 20 on this side, we'll go do 20 on this side. And then after 20 on this side, that's considered as one set. So now we have to do 3 sets of these. So that means we have to start set number 2. So again, we'll start back on this leg 20 times. And after 20 times, we'll go back to the other side 20 times. And after 20 times, we're going to go ahead and start set number 3. So that means we'll go back to this side do 20 times. And then we'll go back to this side. We'll do 20 times. The next exercise will be called leg extension. So we want you to be seated for this one, and then it's very simple. We just want to bring up legs straight out and bring it back, straight out, bring it back, and then we switch to this side, straight out, bring it back, straight out, bring it back. We want you to do 20 times per leg. So we'll be doing 20 times on the left leg, 20 times on the right leg. Once we do both sides, that's considered as one set. We want to do 3 sets of these. The last exercise that we'll be doing is called calf raises. So we want to find a stable platform. In this case, we are using the stair step. So we want to bring both feet up the step. Just make sure that half of your feet are on the step and the other half are off. And then we gently push up and then lower. Up and then lower. Now if you notice, my heel are actually going a little bit below the step. This will help target more of the calf muscles. Again, we're going to go up and lower. Just to make sure you are holding on to something while you're doing this to support, so we won't lose our balance. And again, you'll be doing 20 of this at a time, and we'll be doing a total of 3 sets. So the reason why we do these exercises is to help build up muscle to give better support for our knee, which will enable the meniscus to heal better. I also recommend getting a knee brace, especially the ones with metal supports on both sides. This will also help further stabilize the knee, and of course it will definitely help with the meniscus in its healing process. So good luck, and we'll look forward to see you in the next video. Take care.